I think we can focus too much on the challenges, and actually breastfeeding can be awesome. All formulas are much, much more similar to each other than the marketing would have you believe. What you can never replicate is the live aspect of breast milk. You'll often hear a kind of noise as they feed. I think part of the problem is how Western culture views normal infant behaviour. So not being happy going down in the crib is not a sign of any kind of feeding problem. I'd want to be able to go back to new mum me and go, it will all be okay. Stop being so hard on yourself. You're doing much better than you think.
Welcome back to part 2 of this podcast on baby feeding with our Unii expert, Wendy DOESN'T. In part 1, we discussed common myths and questions about breastfeeding, as well as Wendy's lactation expertise, so be sure to check that out before you join us for this discussion on weaning and bottle feeding. So, let's get started. So, Wendy, we've talked a lot about some of the challenges, but I'd love to know, how can you tell when breastfeeding is going well?
That's a really great question. I think we can focus too much on the challenges, and actually breastfeeding can be awesome. So you know it's going well when you're comfortable during a feed, when your baby's pooing enough, when they're actually feeding a lot. We talk a lot about that 3-hourly feed. And what we mean is actually that 3 hours is a safety net. It's not a goal. So if you fed at 12 p.m. and then by 3 p.m. they haven't asked for a feed, we want to insist they have one. So it's really normal that they would want a feed somewhere in the middle as well. And you should just generally feel positive about it. It's a relationship you've got into with your baby, and you should feel like you want to be there, your baby wants to be there, but really crucially, you should feel like you're getting something out of it. It should feel like a positive aspect of your parenting journey. And actually, for most mums, there is a learning curve. There's a little hump to get over. Breastfeeding definitely starts harder than formula feeding. But very quickly, when you get established, it shoots all the way down to be so much easier. I always say breastfeeding is for lazy mums. Once you are over the hump, you are not sterilising bottles, you're not washing anything up, you don't have to remember to take food with you. You pick up your baby and you could travel the world.
And I think that's fantastic to hear that it's for lazy mums. I look forward to putting that into practice. And we've talked a lot about establishing the breastfeeding, and say you've done that, at what point might you think about weaning? I always get asked in hospital, how long should I breastfeed for? Is there a rule?
The official answer is that the World Health Organization recommends breastfeeding for 6 months exclusively, and then combined with solids for up to 2 years and beyond. In reality, I would say breastfeeding should continue for as long as both people in the breastfeeding relationship want to be there. Okay, it's back to this relationship concept. Like all good relationships, they are there when both people want to be. And unfortunately, like all relationships, the relationship ends when the first person wants out. So if mum wants out, we chat about how to stop breastfeeding and how to gently wind that down. Eventually, the child would also want out. It does tend to happen later. There's some really interesting studies about, if we took culture out of this, when would our children wean from the breast if there was no pressure from anybody? And actually looking at different studies and looking at different mammals and different life cycles, the conclusion that we've come to is the natural term weaning would be somewhere between 3 and 7 years of age, which is often a lot later than most people would think of. And so reality-wise, for most women in most countries of the world, weaning is happening at mum's choice rather than the child's choice. But either is legitimate. And if you've only fed for one feed, that had value. If you're still feeding your 4-year-old, it has value. There's no point where I would say that wasn't worth it, you didn't do enough. And there's also no point where I would say, right, stop now, it's not doing anything.
So we've talked about the duration. So let's say we're moving on to using bottles. Have you got any advice for how to choose the right bottle?
Yes. So when you're choosing a bottle, it really depends on the age of your baby. So let's look at the scenario, first of all, of maybe a mum who's chosen not to breastfeed and she's bottle feeding from the off. You want a nice, slow-flowing teat. We don't want to overwhelm the baby with food. A baby, whether they're bottle feeding or breastfeeding, while they're eating, they have to coordinate 3 things. They have to coordinate their suck, their swallow, and their breathing. if they're not in control of that process, they can get themselves into a little bit of trouble because they'll go for a breathe when they have to go for a swallow because there's milk coming at them. And often you'll see that in a bottle-fed baby by milk being spilt down the side, or they get a little furrow in their eyebrows. That's a kind of stress sign of I'm working a bit too hard on this. Or actually, if you're ever tempted to use the word guzzle with a bottle, oh, he guzzles it down. I always know that's adult-led bottle feeding because the babies are just trying to keep up. Ugh, 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 ugh. So a nice slow-flowing teat, and then using the bottle in a really responsive way so that the baby can start and stop at their own pace. If you're looking at an older child who's already a really efficient, effective eater, they could get really frustrated on that very slow-flowing teat. And so if you were fully bottle feeding, you would wait for that point, and then you would try them on the slightly higher teat. The only commercial bottles that I fundamentally don't recommend are actually those disposable ones that you get told to take into hospital. If you look at the teats on those, there's 3 massive holes, and they're aimed at newborns, and it floods them with milk. It's really inappropriate. It's really uncomfortable for them. It's very difficult to be a responsive feeder. The milk they sell in those little disposable kits, nothing wrong with that. But those teats are really inappropriate, probably for any baby, but certainly for a newborn.
So you've mentioned a bit about formula. So let's talk a bit about the milk. So how can you choose the right formula?
Right. So really important thing to know is that if an ingredient in formula has been proven through research to be of benefit to a baby, legislation actually changes that every single brand of formula must now contain that ingredient. Which kind of makes sense. If we know that this ingredient is good for a baby, how could we in good conscience let it not be there in one of the formulas? Which actually means that all formulas are much, much more similar to each other than the marketing would have you believe. Buying the brand leader is basically paying for the marketing budget that convinced you to buy the brand leader. They're very similar products. I would personally stick with stage 1 the whole way through. Stage 2 formula is an invention, a marketing invention essentially. There is a World Health Organization agreement not to market breast milk substitutes to vulnerable parents, to not try and convince them away from breastfeeding. It's seen as predatory. And the formula companies agreed to this and then came up with a brilliant loophole. They invented stage 2 formula. And stage 2 formula is aimed at 6 to 12-month-old babies and can now be marketed as what they call a complementary food, i.e. like a solids. So if you ever pay attention to adverts for formula, you'll notice it's always got the number 2 on the advert. Now, as a mum or a potential mum, you would never have noticed that in the advertising. So it's just a genius loophole. But actually, that product is much less strictly regulated. So if I was formula feeding, I would give stage 1 till they're 12 months. And from 12 months onwards, they actually don't need any formula.
So whilst we're talking about the different types of formula, what about the content of formula and how that differs from breast milk?
Okay, so that's always an interesting one. Formula companies have obviously spent best part of 100 years trying to get their product as close to breast milk as they can. One of my mentors always used to describe it as they'd have a person standing on the floor and somebody on a ladder and saying, this person is closer to the moon. Now, technically, that's true. This person is definitely closer to the moon than the person on the floor, but in a meaningful sense, they're not. So when they advertise and say they're closer than ever to breast milk, that's the kind of proportions we're talking. The macronutrients are matched. It will have the same percentage of protein. It will have the same percentage of carbohydrates and fat. And they'll put in certain vitamins and minerals. What you can never replicate is the live aspect of breast milk. Breast milk is a dynamic product. Your evening breast milk, for example, has melatonin in it. It's going to help your baby establish their circadian rhythmicity a little bit earlier than a formula-fed baby. It has hormones in it. It has antibodies. One of my favorite things, and I think this is totally a breastfeeding nerd thing that only I would care about, is when your baby catches a little bit of a cold, they will breastfeed from you, and a little bit of saliva backwash, if you like, travels up your body. Okay, and now that virus has entered your body. Your mature immune system has probably seen that virus before, makes antibodies to the virus. By the next feed, antibodies are coming back to your baby, specific to that virus for your baby. That's something that could never be replicated. So while your baby will grow and they will be fine on formula, you cannot compare them as products.
And that's also something I found really fascinating about that saliva backwash, especially as somebody who works in the emergency department, and I'll be seeing children with lots of coughs, colds, all sorts of viruses over the winter. And I suppose passing that immunity to and from my baby is something that I'm really keen to do.
It's really important. And I think it's important to know that breast milk is not magic. It will not stop your child catching a cold. But as you'll know better than me, a child's immune system is not mature till they're about 5 years old. And when they're a little baby and they get their first cold, it's the first time their body's ever seen it before and met it before. What you're doing by breastfeeding them is giving them borrowed access to your mature immune system. You're supporting and shoring up that immature immune system until they're ready to run with it themselves. So they will still catch the cold, but they will get over it much more quickly than if they were not breastfeeding.
And what about things like vitamins and minerals in the formula feed as opposed to breast milk?
So all the vitamins and minerals you need are in your formula. In your breast milk, there is one exception where we do need to supplement, and that's vitamin D. Certainly, living in Northern Europe with the little amount of sun we see, we come to the conclusion that the vast majority of mums are vitamin D deficient themselves. If mum is vitamin D deficient, unfortunately, she doesn't have the vitamin D to put into her milk, and therefore baby needs supplements. If mum is sure, because she's routinely and conscientiously takes her vitamin D supplements, that she's okay, baby actually doesn't need supplementing. But as a universal health measure, it's just less expensive to supplement every baby than test every mum.
And I think vitamin D is something we've talked about quite a lot more recently as people are becoming more aware of vitamin D deficiency and sunlight and how we produce that in our bodies. And I just wondered, do you know anything about whether there are any cultural differences on the content of formula, or whether over time the content of formula has changed?
So the content of formula has definitely changed, and it evolves. And as soon as research shows us that something's useful, it goes in. So, very early formulas were just simply slightly watered down cow's milk, going back 100 years or so. They have changed, they have got better, but it's not the biologically normal food for your baby. But yes, definitely in terms of macronutrients and everything else, it's enough. The way I would look at formula is very much how you might look at the NICU for premature babies. I think nobody would argue that we should get you at the beginning of your third trimester to birth a premature baby because we've got the technology now to keep them well, right? We all know the best place until the end of your pregnancy is exactly where your baby is right now. But if you were to have a premature birth, isn't it wonderful that we have the medical capability of keeping that baby safe? And that's how I look at formula. You can't argue that it is an equivalent product, but if you can't or don't want to breastfeed, isn't it wonderful that we have a product that will keep them safe?
Yeah, I completely agree. So something I've developed in my pregnancy, unfortunately, is reflux. I hear this word a lot also in my day-to-day as a paediatrician in the emergency department. So for me personally, that is the acid in my stomach traveling back upwards, usually causing a metallic taste in my mouth. And I know lots of babies also suffer with reflux, where their milk perhaps comes back up into their mouths. They may have a small vomit after feeds or be slightly unsettled after those feeds. And usually that's because the baby's food pipe is still developing. And as they grow, things do generally get better. I just wondered, the advice that we give in hospital is what we call conservative management. So encouraging the baby to be kept upright for as long as possible, to encourage regular breaks during a breastfeed, to burp the baby, and sometimes also advising that the baby is propped up a little bit when put then flat by putting a towel or something to raise the mattress at the head end. Is that the same kind of advice you would give for mums who are facing reflux in their babies?
So I think the first thing we have to chat about is actually the difference between normal reflux and what I would call medicalized reflux. So normal reflux is baby just spits up a little bit. The end of a feed, a bit of milk comes up. That's really normal, really expected. And even if it looks like it's in huge volumes, if the baby is not uncomfortable, we kind of call it a laundry problem rather than a medical problem, right? So if a baby's just going, carry on with my life, That's really, really normal, assuming weight gain and everything else is going okay. What we worry about more are the babies who are in pain and discomfort, exactly what you're getting in your pregnancy, that acid reflux, that really uncomfortable reflux. Those babies tend to scrunch and scream and really struggle as they're bringing the milk up. They're the babies we want to take care of. There's a few conservative management things we can do. We want to make sure they're well latched. If you have a baby who's on a really shallow latch, because mum's actually got an excellent supply and they just get vaguely in the zone and loads of milk comes at them, you'll often hear a kind of noise as they feed. That noise is them breaking the vacuum seal every time they take a mouthful. If they break the vacuum seal, a little bit of air is going to go into them and they're going to swallow air with every mouthful. That's going to cause them really significant discomfort. It will cause them to spit up more. It will cause them to be unsettled. And very often they'll be popping to their GP with reflux. In actuality, if we can fix the latch and get things more comfortable, the reflux itself will disappear. So we really want to make sure that the cause of the reflux is sorted. And then all those management techniques that you were talking about, babies instinctively who are breastfed self-manage their reflux by having small, frequent feeds. You've probably felt this yourself. After a big meal, you're much more likely to have a reflux attack. And so you learn to have small snacks really frequently. That's exactly what your breastfed baby will try and do to manage their own reflux.
And we've talked a bit about the different types of formula. I've come across some families who try the anti-reflux formula or the hungry baby formula for the baby that doesn't seem to settle after a feed. Are these truly things that help?
No, these are truly things that are brilliant marketing tools. I would say the safest thing for your baby, unless you've been prescribed differently and really getting into the sort of prescription formulas, is the very bog standard stage 1 formula. If your baby is having challenges with their feeding, speak to a feeding expert. How you're feeding them, the volumes you're feeding them, the responsiveness with which you're feeding them is more than likely an issue. I think part of the problem is how Western culture views normal infant behaviour. We have to look at the breastfed baby as the norm. And actually what we should be doing as bottle feeding parents, trying to replicate that norm as far as possible. So it is frequent feeds. Babies aren't petrol tanks. It isn't the more I fill them up, the further they'll go. And that's something that a lot of bottle feeding parents are encouraged to do. And that causes discomfort. And so your baby wakes really frequently after a feed because they're uncomfortable from that really big meal. And then you feed them again. And then they're really uncomfortable and crying. And then somebody says, gosh, you've got a hungry baby because you gave them this big feed followed by that giant feed. And now they're still crying. Maybe you need to give hungry baby formula, when actually what you need to do is just chill a bit, let them regulate their own appetites, and not expect babies to go down in their cot just because they've been fed. They're not robots. They are very tiny little people whose every instinct in their body tells them that this is a safe place to be, and they will learn that that is a safe place to be, but they don't know it on an instinctive level. So not being happy going down in the crib is not a sign of any kind of feeding problem. It's just a sign of a really normal baby.
So something I recently came across in the hospital is a new mother who came in with her baby, and she was concerned about how frequently she should be feeding. She had come in contact with 2 different healthcare professionals, one of whom who told her that she must feed every 3 hours, and the other who told her to feed her baby on demand. Her main concern was the fact that in the first couple of days, she didn't really know what on demand meant because her baby hasn't really established a schedule with her and she's only known them for 2 days. So I just wondered, what kind of advice do you have for those first few days and the frequency of feeds?
So initially, when your baby's born, we feed responsively, but with a safety net. So what do I mean by that? I mean every 3 hours is the very longest we will allow a baby to go without food. And when we're talking about that every 3 hours, it's really important to know that we're measuring from start of feed to the start of the next feed, which shocks a lot of parents because, a feed can take an hour and a half or 2 hours in the first few days. And then an hour later, you're due the next feed. So that can be quite shocking as an introduction to feeding. We keep doing that until babies hit 3 milestones. They need to be past their own due date. They need to be past their own birth weight, plus they must weigh at least 3 kilos. We know that babies who haven't hit all of those milestones are at risk for sleeping through their own feeding cues, and therefore you could be the most responsive mum in the world, but if your baby's not asking enough, then we have to just kind of give them a bit of a nudge. Once you've hit that, once feeding's established and they're growing well, they've hit all those milestones, I would argue that responsive feeding is the way to go forevermore. In the same way as when your 7-year-old child comes to you and says, I'm hungry, you're probably going to give them something to eat. You're not going to say, you had breakfast an hour ago and it's not lunchtime till 12. You'll respect the fact that they're listening to their own body and they're hungry. And we would do that with babies as well.
And so is that the kind of thing that you followed also with your own children when you were feeding them in those early days to weeks?
Yes, absolutely. Always fed on demand, in fact. My oldest child, she was a real, what I call super glue baby. She just wanted to be here for about 3 or 4 months. Nowhere else would do. And she would feed very frequently. And, the most common question I got people was, oh, she's feeding again. You sure you've got enough milk? Now, she was growing perfectly, but she was a contact baby. And so it was her happy place. And that's where she wanted to be. And I know this is a long time to wait for the upside, but at almost 18, I still get cuddles off her. She is a super glue child. She likes to feel that physical contact. In contrast, my second child was very much feed me and then kind of get out my personal space, please. And he was an angel of a baby. And actually, again, his babyhood makes a lot of sense given the person he is now, whose favourite thing in COVID was people stopped touching him.
So talking about your kids, I think you mentioned earlier that your son had a tongue tie. Yes. Now, this is something that I've come across a lot also. And for our audience, just to clarify that all of our tongues are attached to the floor of our mouths, but in some cases that attachment may be shorter or slightly different, which affects the way your tongue is able to move. And in some cases, it may impact on the feeding, and in others, probably most cases, it doesn't. Is that something you come across a lot? And how do you support families with babies with tongue tie? Absolutely.
I come across it a lot, and it's actually one of parents' real bugbears that nobody seems to be able to diagnose a tongue tie. And exactly what you said, I always say to them, we're all tongue-tied. Our tongue is tied to the floor of our mouths. It comes down to functionality. So what you can't actually do is look in a baby's mouth and say, that tongue absolutely needs a release. It is a combination of how flexible that frenulum is. So you can sometimes see a really visible frenulum, but it's really stretchy and it's not causing them any problems at all. Sometimes mum's anatomy and baby's tongue is a fit or a slight mismatch, and releasing the tongue would help. So our first step is always looking at positioning and attachment. And if mum is still in really significant pain, or baby just can't stay latched, or they're just working so hard they run out of stamina before they run out of appetite, we would consider referring them to a tongue-tie practitioner to have that released. But it's what I would call a grey area, because it's much trickier than just looking in their mouth and saying definitively, this child has a tongue tie and releasing it will make all the difference.
That's really useful advice. So we've all heard the phrase 2 under 2. So when you've got 2 small children and they're both under the age of 2, and at some point, presumably, there will be a stage where you've got a small child and you're also pregnant and you may be breastfeeding that child. Is it possible to breastfeed when you're pregnant?
100%. So lots of women do what we call tandem feeding. So a lot of the times it depends on your child's attachment to breastfeeding. Somewhere around the beginning of the second trimester, a lot of women find their supply really dips. And so some children self-wean at that point as a kind of, I'm not getting so much. Others do what we call dry nursing or reduced supply nursing through the pregnancy. And then mum carries on to feed both children once the baby's born. A lot of mums report that bonding between the siblings is increased when they can feed them both together. And I've seen some glorious photos of the 2 babies, holding hands while they're feeding and they're learning to share. One thing you want to be careful with tandem feeding is that as you're establishing feeding for the newborn, they get priority and the toddler gets leftovers essentially. Once you're more established, you can be a little bit more free and easy with it. You just want to make sure that baby's getting first access at the beginning.
And we've talked a bit about the duration of feeding, what's recommended and what you might like to do. But say that you've established breastfeeding and you now want to start weaning. There's a bit of differing advice on when that can be done. 6 months. Some people have said 4 months. How do you know when your baby is ready to wean?
Right. So it's really interesting. You'll hear a lot of people saying, oh, the advice flip-flops, 4 months, 6 months. In actuality, the World Health Organization since 2001 has recommended 6 months. So we're essentially a generation where it's been just 6 months. It's just most of your parents will have been having differing advice. There's a few signs of readiness for weaning. One is the 6 months chronological age. If you've had a premature baby, have a chat to your medical provider about whether you're going 6 months adjusted or 6 months chronological. It's a little bit more grey for those babies. But there's some other signs they need to have, more physiological and physical signs. Your baby needs to be able to support their core. They need to be able to sit in a high chair and not slump over like that in a sort of 10, 15, 20-minute period. They need hand-eye-mouth coordination. They need to be able to pick something up and put it in their mouths. Crucially, they need to have lost the tongue thrust reflex. This is a reflex that babies have that's very protective in their younger months, where if something foreign goes in their mouth, that tongue does that to push it out. Now, obviously, I can't chew and swallow food if my tongue is doing this all the time, so I need to have lost that reflex. Once you've hit all those stages, your baby's ready for solid foods.
That's really helpful. And what about introducing water? Having dealt with lots of different families from all over the globe, I've come across a few cultural differences in that. In some, especially hotter countries, water is introduced into the diet a bit earlier. And I'm quite clear as a paediatrician that we don't encourage water until the weaning process starts. What kind of advice do you have about water?
Right. So for breastfed babies, what's really interesting is if you are in a hot climate, the percentage of water in your breast milk actually increases. So your baby might drink 10 or 20% more milk over the course of the day because they're coming back frequently because they're thirsty. But nutrient-wise, they're getting exactly the same as the baby in a cold country who's feeding slightly less often and slightly smaller volumes. So it's really important we don't give those babies additional water. They're getting the additional water from their milk. And if you give them water on top of that, they've had double loading of the water and not enough of the nutrients. If you're formula feeding and it's an incredibly hot place, it is advised every so often to give a few sips of water here and there, but still not in significant volumes. We don't want to displace tummy appetite for formula or for breast milk with water.
And having spent time with friends who are going through that weaning process, I've seen some different pouches that you can buy over the counter versus some homemade sort of ice cubes of different foods that you store. What kind of foods did you make for your children when you were starting that weaning process?
Right. So for my first child, I did actually go through the whole puree stage and I homemade those. There's almost 4 years between my two children. And then my second son, when I started trying to give him purees, he would just turn his head the whole time and be like, you can't feed me, which makes total sense now given the person he is. But he led me to discover baby-led weaning. And what's really interesting about baby-led weaning, it simply means letting baby feed themselves. Now, if we look back historically, babies were being weaned onto solid foods at 3-4 months. If you think back to all those physiological and physical developmental milestones they have to meet to be ready for solids, it's really clear that a 3 or 4 month old baby has not met those milestones. So instead of thinking maybe those babies are not ready for solids, some bright spark decided to turn solids into a liquid and shovel them into babies. What those babies would then do by 6 months is move on to what was called finger foods and be eating real food. If we simply wait for that 6-month mark, wait for babies to be physiologically and physically ready for solids, you don't need the whole puree stage. You can just go straight to your baby feeding themselves. So good news is you can skip the whole purees. If you are going to puree, then it's really important that most of what you're making is fresh homemade food. All of the pouches, even the ones that read beautifully on the ingredients in the back, are an ultra-processed food. So if I was pureeing some apples and strawberries, for example, what I would home make as a puree is a slightly coarser texture than the very, very smooth purees you would get industrially. Because they've been industrially pureed, it breaks down those cells, which means all the carbohydrates do convert to sugars very, very quickly. And so it's actually a much higher sugar product, if you like, than the exact same ingredients you would home make. University of Glasgow did some research where they noted that the savoury purees, if you like, or infant foods, if they would call it a fish pie, would have approximately half the protein in it that people would instinctively make if they were home making it. So they're not as nutritious. They noted that 65% of commercial baby foods are very sweet, developing a preference for a sweet palate. So I tend to go on an 80-20. If 80% of the time I'm giving my kid good home-cooked food, 20% of the time I can cut myself a break and do something more convenient.
And what about seasoning for the food that you make at home?
Right. So don't be scared of flavour. For children under 1, we can't add sugar, salt, chili or honey. But beyond that, add everything. We want, what is our ultimate goal with weaning? It is to bring our children into the family diet. Don't make the mistake of kid food and adult food. Make what you're making. If you are making a curry full of, cumin and coriander and cinnamon, use those spices. That's brilliant. Introduce flavour to your babies. Skip the chili. Add that in for yourselves once you've taken their portion out. Skip the salt, but definitely don't skip the flavour.
We ask you a few questions about you personally to get a chance for our audience and also for myself to get to know you a bit better. So I'll ask you a few questions and then if you could answer them as quickly as you can.
Okay.
So we'll start with, tell us a hidden talent that you have or something that people don't know about you.
Ooh, I actually have a photographic memory, which has come in hugely useful for things like passing exams, but actually also with infant feeding, it's brilliant because I hear an interesting fact and that's it, it's in the repertoire forever.
Amazing. That's really useful to have. And when did you discover that you had a photographic memory?
Pretty much on the bus on the way into exams at school. Last minute cram of the notes and suddenly it was there.
So I guess that's probably one of your natural superpowers. But my next question was, if you had a superpower, what would it be and why?
You know what? I'd love to be able to time travel. I'd want to be able to go back to new mum me and go, it will all be okay. Stop being so hard on yourself. You're doing much better than you think.
Okay, yeah, that sounds like a valuable skill to have. And a quick fire round now. So I'm going to give you 2 options and I want you to choose between them. So cats or dogs?
Oh, I have to say dogs. We've got a dog.
And coffee or tea?
Always tea.
Early bird or night owl?
Night owl every day.
Skimmed, semi-skimmed or full fat?
Full fat.
And your favourite ice cream flavour?
Ooh, mint.
Good choice. And my last question is, if you had to describe yourself in 3 words, what would they be?
Oh, that's a tough one. Friendly, caring, and I'm going to give it 2 words. Friendly and caring.
Oh, both lovely and also very relevant for your profession. So with that, Wendy, we've come to the end of our discussion today and the end of the podcast. Thank you so much for joining us. It has been incredibly insightful to hear about many of your stories with your own children, with your clients, to really clarify some of those nuances to breastfeeding, bottle feeding and weaning. And I'm sure everyone out there watching, and myself included, can say I've learned a lot from you. And I'm feeling a lot more reassured about this process that's coming. So thank you very much.
That's my pleasure. And I'm glad you're feeling more reassured because the bottom line you should take away is this is normal and it should be easy once you get over the hump.
Thank you.